Well, I was thinking, I'm writing some notes, but this last session generated some questions. If we think about the business model at Mike Lauer, I mean, the Japanese auto industry ought to be a sufficient example of using experimental design, quality improvement methodology, which in some cases includes randomization, some not always, to show that the impact that that strategy had on their business compared to what we were doing in the U.S., which was more or less the way we conduct medical practice, one patient at a time. Second of all, Nancy made a comment about the HIV community. I was involved in the early days of the AIDS clinical trial group, which was pretty chaotic at the beginning, I would have to say. And I was on the monitoring committee for I don't know, about 10 years. But there was a time when we were under siege by everybody. All the stakeholders were mad at us for doing randomized trials. But a phenomenal thing happened, and that is that the principal stakeholders, i.e. the patients, the infected individuals, understood the research methodology and what they were getting if we didn't do it this way, which was not very good answers. And they became our strongest advocates. These we want the right answers the fastest way, but we don't want answers that are unreliable. That doesn't do us any good. And so we went from a place of being under siege to having a fantastic advocacy group. And I think I didn't stay with that research forever, but that was a phenomenal sociological, cultural change to observe. And it happened within a matter of a couple of years, but it was very stormy, and we really felt. So I think, and they knew what the stakes were. They educated themselves and realized this was the best way. Another general comment is, well, first of all, large numbers don't reduce bias. You can write down the statistical mathematics if you want to, but large numbers do not reduce bias. We have a ton of examples in cardiology and cancer where I at least have some familiarity. We have huge observational studies that have given us absolutely the wrong answer. For the women, HRT is at least one of your examples that you ought to be familiar with. I also resonate with the idea that it's very hard to move your question into the top 200. Most CTSA sites, the Clinical Translational Science Award sites, were mandated to generate warehouses, data warehouses. That's moving data out of the EHR, the live version, into a warehouse version. Just getting that done, first of all, it costs real money. It's not, even if you have Epic or the equivalent system, it costs a lot of serious money. And two, to get that priority moved in there has been a challenge for most every site, except for the few who own everything and they can decide what the hell they want to do. So it is doable, but it is not easy, and it challenges priorities. I also like the issue of we need to pick up the pace. I spent the first 12 years of my career at NIH, so I'm an NIHer, I guess, for life. But the process we have is very slow. We build a trial network, we fund it, we tear it down, we start over for the next one. Now, there's been attempts to build networks, and in some cases, they have been standing. But we have a process that, by its very nature, by the standards we insist on, is very slow. And I don't know, I don't have any answers to solve that, but clearly it's going to be challenging for the academic world to pick up the pace. And maybe the academics are too guilty of following the money. What can get funded? Every investigator in academia survives because they have a research grant. And you may have the best, most important question in the world, but if nobody's going to fund it, you're out of luck. And your academic career is in serious trouble. So those are just some quick thoughts about comments I heard during the day. But clearly, the electronic health record is here to stay. The large, simple trial exists. It's been successful. We can use it a lot more. We need to figure out to harness them. But it is more. It's not a panacea. It's not simple. It's not cheap. But I think it's where we'll have to go to stay competitive.
Those great comments. I just want to thank the speakers today. I thought it was a fantastic day. Afternoon, I took 8 pages of notes here, and I'll spare you with the comments on all of them, but then just end with a few general comments. To dovetail with Dave's comment, it's pretty clear from the speakers that there is a compelling need to basically harness the digital medicine revolution and look at how we can make EHRs compatible with research going forward. It's inevitable. It's going to happen. And I didn't hear any problem that was unsolvable. I mean, that's the key. However, when I moved from academia to industry, one thing that became very clear to me is how to manage complexity. And if you look at a lot of business cases, when companies get too complicated, they have to break up. But there's a point where complexity is impossible to manage. That is whether or not you have too many businesses, too many geographies, and you can't use strategical processes to actually manage the whole group. And I think that that might be an issue of what we're seeing here. We have this tremendous complex system that's highly intertwined. There's a force of nature here. We have massive demands by stakeholders to get new information. That's not going to stop. There's high capability, high competency, and there's a lot of money and resources available. But what's going to unfold is either an evolutionary process or intelligent design. And I think we have to kind of figure out which one's which. If we look at the evolutionary process, it's going to happen. It'll be survival of the fittest, and there will be failures. It'll be slower, and some people will be harmed. And so we can sit back and let it happen. It will happen. If we move to a more intelligent design approach, the pros will be that we'll get there faster. The cons will be that we'll have to invent bureaucracy to manage this. There's no question about it, because there's too many moving parts. There will be interference and disruption. If you let things evolve, the disruption will be minimal. If we wanted to actually take an approach to try to coordinate, it will be disruptive. It'll be like change management. There's always this ugly kind of inefficient part that happens before it starts to get better, and we have to be prepared for that. But no doubt it will require massive coordination and cooperation for us to settle the problems we talk about here. So I think maybe tomorrow we can think about, do we have the energy to be able to do this? Because this is a massive management issue here to make this happen. Or do we just sit back, do small projects, and let the natural forces of nature take over and let this thing evolve? I would opt to feel like we should focus on the design part, because I think in many ways we'll get there faster with less harm at the expense of potentially developing management bureaucracy. But that might be something we think about going forward, and I'll end with that comment. Maybe we should go tomorrow. Yeah. Yep.
So tomorrow we have more discussions. We're going to talk a little bit about what is some of the policy changes. What's getting in the road? Why aren't we moving faster? And we're going to have some speakers address issues that relate to policy changes, ethical issues, and some of the issues related to IRBs and some of the other regulations. We're going to talk a little bit about simplifications. We alluded to, or at least I alluded to earlier, that we have a system right now which is very complicated, very complex. So I think of it of a trip I took a couple summers ago across following the Oregon Trail. And one of the things you observe very quickly is that the pioneers that loaded up their wagon with everything they think they needed to know soon began to throw the baggage overboard. If they survived to get to where they were going, they had to do that. And we have now loaded up our clinical trial wagon so heavy we can't pull it anymore. We can't afford to pull it. So we got to do something. So we're going to talk about ways to perhaps simplify, and also the last part is, okay, so we've had this wonderful discussion, or didn't have where do we go? What's next? And that's going to be a real challenging part. And unfortunately, I drew the short straw to chair that session. But at any rate, I look forward to tomorrow. You guys have really been engaged, which makes it a fun workshop, and I think it shows the interest and the value. So I look forward to tomorrow's discussion, and we still have, I guess, time for some general discussion now, or we can hit the showers.
Any burning questions out there? All right, well, then we're officially adjourned. Thanks.